Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Do you know that 70% of your immune system cells live in your gut? That's a startling number, but it also goes to show you how important it is for you to keep your gut healthy and your gut microbiome healthy. So, what is a gut microbiome? Well, we're going to talk about that today, and we're going to give you tips on how to stay healthy and how to keep your gut healthy, as well as answer your healthcare related questions here on this episode of Ask the Doc. No appointment needed. Really? And welcome to Ask the Doc, no appointment needed, the show where your healthcare questions are answered by our medical experts. My name is Dr. Kamaljit Kaur, and I'm a double board certified primary care physician here in beautiful South Florida. It's great to have you here with us today. So let's get right to it. Our first question comes in from Spencer, and Spencer writes to us asking, I was at my doctor's office and he mentioned in conversation that bacteria in my gut actually kept me healthy. He also talked about microbiome. Can you explain what that is and help me understand how bacteria may actually be good for me? Hi, Spencer. Thank you so much for writing in with this important question. And it's a very common question, too. There is good bacteria and bad bacteria in your gut and other microorganisms. But you know what? Let's take a minute to define what the gut actually is. Because a lot of times, majority of people who are not in medicine think about the gut and they think about maybe the belly area or the intestine. But you know, the gut actually refers to your entire digestive tract, which starts from your mouth and can go all the way down to the rectum. Or not can, but it does go all the way down to the rectum. And this tract is lined with good bacteria, bad bacteria, good viruses, bad viruses, good fungus and bad fungus. And you get the point, right? So all these microorganisms, they have this little community in our bodies, and the good ones, we want them to be there because they help protect against disease, they keep inflammation down, and honestly, they keep us healthy and help prevent us from getting unhealthy. So how do we get a microbiome in our gut or honestly, even our skin? Are we born with it? Not necessarily. While there is now some emerging research that shows babies may have some microorganisms in their microbiome and in their gut when they are born, we do know that majority of the microbiome, especially the gut microbiome, is developed over those first few years of life. And that can actually heavily impact what diseases, what conditions, how healthy the baby is going to be as they grow. You know, their immune system, their nervous system, every system in the body is eventually affected by your microbiome. And generally, a child's microbiome is quite healthy, but there are factors that might disrupt this healthy environment. And now we're finding that this actually might be the main cause of several different types of diseases like heart disease, diabetes, asthma, allergies, skin diseases, all that stuff that's quite common, but maybe you've not really thought of the fact that it could be really affected by your gut, the things you eat and the things that live in your digestive tract. So how do bacteria protect us? I know it's kind of silly sometimes, right, to think about, because when we talk about bacteria, immediately we think, oh no, bad, antibiotics, please, right? But that's not necessarily true. One of the most important jobs of good microorganisms, good bacteria, good viruses, good fungi in our body is to protect us from the bad ones. Simply put, they act like little soldiers that form a line of defense or a fort of sorts and keep the intruders from coming in. Some good bacteria can even help to strengthen our immune system by provoking it to create the antibodies that help fight those intruders, whether those intruders are bad foods, bad drinks, bad bacteria, bad viruses, and it helps keep us healthy. Lastly, did you know that healthy bacteria on your skin can actually be very, very beneficial? One of the main mechanisms that they help us by is by keeping us hydrated and preventing too much water from being lost from our skin. Your skin is actually the biggest organ in your body, and people don't think about it much in that sense, but it's true. So, just like in your gut, you want to make sure that the bacteria, viruses, and fungi that naturally live on your skin are the healthy type. While there are several other functions that the good bacteria in our bodies do, these are probably some of the most common and most important. Let's continue on. The next question we have comes from Jonathan, and Jonathan has emailed us asking, I'm 48 years old and I exercise and try to keep myself in shape. But no matter what I do, I can't get rid of my gut. My wife keeps telling me that a man's gut size could be a precursor to health issues. Can you explain if that's true? And what can I do to get rid of my gut? Hi, Jonathan. Thank you for sending in this question. And I'm sorry to hear of your frustration. And the reason I can imagine you're frustrated is because it's so disheartening when we try to do our best to be healthy and we just don't get the result that we want. But don't be disheartened. Please keep trying to do your best to stay healthy. While there can be many reasons why this is happening, and there are likely several different things that are contributing in your body to promote that gut or that abdominal fat accumulation or visceral fat accumulation that we call, really, it's something that can be quite harmful and it can predispose you to certain diseases. So I understand your wife's concern. Research has actually shown and revealed that abdominal fat, or the fat that's primarily in your abdomen, so the area below your chest and above your hips, that's where most of your vital organs are, including all the abdominal and gastrointestinal organs. When these organs start to obtain fat around them, or fat starts to build up around them, that actually is very, very, very inflammatory. And probably five more varies after that. And it sets you up, or it can set you up for diseases like high blood pressure, high cholesterol and heart disease, diabetes, metabolic syndrome, cardiovascular disease, and honestly, some cancers have been linked to it as well. And one of the reasons is because when fat accumulates along those organs and induces all that inflammation, it actually can also induce insulin resistance, which is a whole other ball game that really contributes to a lot of diseases we're now seeing. So, how do you reduce your waist size and your risk of all these diseases? Well, the cornerstone of treatment here is really a healthy lifestyle and weight loss. And I know it's easier said than done, but you know what? Let's talk a little bit about it, because sometimes we think we're doing things that are healthy, but maybe they can be tweaked a little bit, or maybe they're not healthy at all and we're just misunderstanding. So it's always good to make sure that you have the right information. Now, as we mentioned, that fat that accumulates around your liver, your spleen, your kidneys, that visceral gut fat is very, very harmful. In fact, it's probably the most harmful of the types of fat in the body. However, this is also the type of belly fat, or sorry, this is also the type of fat, also known as belly fat, that is most affected by a diligent and hardworking and effective lifestyle change that induces weight loss, healthy weight loss. I must always say healthy weight loss, right? While I encourage you to talk to your primary care physician about your particular instance, because a lot of things have to be taken into account. What is your lifestyle like now? What needs to be tweaked? Do you smoke? Do you drink? What kind of things do we, as your doctor, need to work on with you to really guide you in the right direction? So, personalized advice from your PCP, but here's some general recommendations that I have. One of the best things that you can do is a whole foods anti-inflammatory diet. The Mediterranean diet is something that's proven very, very beneficial when it comes to weight loss and reducing a risk of heart disease and heart attacks and strokes. So that's something you want to be mindful of as well. Engaging in aerobic physical activity. And I know this is becoming harder and harder as majority of us nowadays have desk jobs and we're kind of just sitting at that desk for 6 to 8 hours with minimal walking up and getting around. So I know that can be a bit tough to do sometimes, but you want to make sure that you're trying to get at least 150 minutes of moderate intensity physical activity per week. Not day, per week. So what is moderate intensity physical activity? Everybody's level is going to be different. What's considered moderate intensity for me is going to be different for you, is going to be different for your wife, et cetera, et cetera. Basically, and there's a lot of calculations that fitness professionals will probably have you do and personalize to you that can tell you exactly what your intensity level should be. The general rule of thumb is if you're engaging in cardiovascular exercise, so if you're on a treadmill, if you're swimming or you're on elliptical, anything that's got your heart racing and you're moving, if you can talk but not sing, then you're pretty much at your moderate intensity level. And I know that sounds silly. Who sings when they're on a treadmill, right? But now watch, I bet all of you are going to do it. So if you're at that level, then your heart is pumping, your internal systems are going, and that's considered your moderate intensity. Again, that's a very, very generalized rule. You always want to talk to your physician and a fitness professional for more personalized personalized recommendations for you. The other thing that's really important to do is healthy calorie restriction. I know sometimes people go on fad diets and try to cut out everything, and that's not healthy at all because you need calories, your body needs energy, and it needs nutrients, and it needs all that good stuff to work properly. So you want to make sure that when you're doing calorie restriction, you're doing it in a healthy way, personalized to you, to your body weight, and to your underlying health conditions if you have them. The other thing that people sometimes don't think about is stress reduction. When you're stressed, especially chronic stress, you're stressed every day, all the time, and it's affecting you in many ways. But stress in general promotes the release of a hormone called cortisol, which I know a lot of us are familiar with now. And cortisol can be very inflammatory and it can be very dangerous. Of course, it's a naturally occurring hormone. It has its natural beneficial effects in our body, but when it comes out in excess, then it can be harmful and it can lead to other problems, either in other hormones in the body or other mechanisms of our health as well. So you want to make sure that you're trying to reduce stress as much as possible. The other thing you want to really make sure you're doing is avoiding any kind of smoking and alcohol. Now, with alcohol, there's always a little bit of controversy. Is one glass of wine good? Is two glasses of wine good? Or is no wine good? And I know there's been back and forth a little bit in the medical societies. And again, that needs to be personalized to you. If you're somebody that has several underlying health conditions, I would suggest that you avoid alcohol altogether. Now, there are times when I have patients who say, well, it's my birthday, I just want a glass of wine and that kind of stuff. Again, always personalize things for you, talk to your doctor and see what is safe for you. Excuse me. But for the most part, you want to avoid alcohol. And sleep. A lot of people underestimate the importance of sleep. Sleep is really, really important, at least 7 to 9 hours a night. And that's going to get you into that really restorative sleep so that at night when you think you're sleeping, your brain is firing on all cylinders to repair, to restore, and to really get you ready for that next day. And so you can be your best. I know this seems like a lot, and I know it's probably like, okay, this is all easier said than done. But I really want to encourage you to take it slow, take it step by step. Rome wasn't built in a day. Don't try to make any drastic changes because that's actually more harmful than beneficial. So pick one thing in your life that you want to change and you want to be healthier about and do that for a couple weeks and then move on. And you'll see that as these things become a lifestyle and you become healthier, it's going to affect your internal systems. It's going to affect your gut microbiome, and you are going to feel better. Now, should you diligently follow lifestyle changes and recommendations associated with them for at least 3 months, and you're not seeing any kind of change and that gut just isn't going down, then you might need additional treatment. You might need additional treatment through medications, even depending on, again, your actual body weight and your underlying health conditions. You may even be a candidate for weight loss medications, which not everybody is. And that's really important to know. I know they're out there and they're everywhere, but it's important to talk to your doctor about what they are and if they're safe for you, because they may seem like an easy fix, but they can actually have some harmful side effects as well if not taken appropriately. So please do sit down and have a thorough chat with your physician. And I hope that over time, you're going to find the benefits of all of this and you're going to see the results as well. All right, let's get to our next question. This one comes to us from Rachel, and Rachel asks, my friend was reading up on gut health and gut healing and came across something called the 5 R's. Can you tell us more about what those are? Absolutely. Now, before I dive into answering more about what the 5 R's are, ours are. So I'd like to talk a little bit about functional medicine. This is a field of medicine that's come out in the last several years. And I say last several years, it's been around much longer than that. But I think when I say several years, that's pretty much when conventional medicine started thinking more about integrative medicine and functional medicine. And what functional medicine is a practice of medicine that focuses on getting to the root cause of disease and not just treating its symptoms, which unfortunately has been the mainstay of conventional medicine for many, many years. Now, functional medicine, you get into the nitty gritty really and really try to figure out, why are things this way? Why is the body reacting like this? And what can we do at that root cause level to really fix it and to make it better? And so in that sense, the 5R protocol, or the 5R approach, is a functional medicine based protocol that promotes healthy guts and healing and repairing unhealthy guts. So what are the 5Rs? Let's get into it. Number one is remove. So you want to remove all the bad stuff, all the inflammatory foods, processed foods, refined sugars, dairy, especially if dairy is irritating to your stomach, alcohol, excess caffeine. So all these things can combine and be harmful in your gut and promote the growth of bad bacteria and bad microorganisms. So you want to take all that stuff out first thing. And after you do that, remember, it's not necessary to do all this at the same time. So this is stepwise. So after you remove the harmful substances, you want to replace it with the good stuff like digestive enzymes. And then after you do that, the next step, the next R, is called re-inoculate, which basically means reintroducing the good stuff, the good bacteria, the good microorganisms. And you can do this using probiotics and prebiotics to help really establish a new balance, a good balance of microorganisms in your gut. After you re-inoculate, you want to start to repair, because repairing is pretty much what we're trying to do here, right? And when you repair, you're supporting the integrity and the function of the gut mucosa, or the gut lining. And you do this with nutrients such as zinc, glutamine, omega-3 fatty acids. Those are wonderful for so many reasons, and a variety of antioxidants. These can all help with gut mucosal lining. It can help repair it. And once it's repaired, it's a strong barrier to all the bad stuff coming in. So you really want to make sure you're doing that too. And lastly, but definitely not leastly, you want to rebalance. So how do you do that? You address the lifestyle factors that we were just talking about: stress management, sleep, physical activity, healthy diet. All of that really works in its own way, but really well together to promote a good gut and brain signaling mechanism. And basically that's what we're trying to achieve here. It's also important to note, though, this all sounds great, and the 5Rs in theory should work wonderfully. However, as far as traditional and conventional medicine goes, we just don't have enough research to know exactly what we need to do for each person, exactly how we need to do it, etc. And due to the lack of that type of research and studies at the moment, at least, this is not a protocol that's widely accepted by most medical societies or the gastroenterology societies either. But either way, in theory, it sounds great. So do talk to your doctor about it and see if this is something that might help you. All right, let's move on. Our next question comes from Freddie, who is a very important question, and he writes to us asking, "Hi, Dr. Kaur. I want to go back to what you talked about earlier. Can you tell me some things I can do to maintain a healthy gut?" Thanks for writing in, Freddie. I want to share some really good tips, because I know I've talked a little bit about diet and exercise and all that stuff, but here's a little bit more detailed information on how to maintain a healthy gut microbiome. So, as I mentioned a little bit earlier, you want to eat prebiotic fibers. Now, prebiotic basically means these are substances that feed the bacteria, or feed the good bacteria actually, in your gut. And you can do that with things like oats, apples, onions, asparagus, bananas, flaxseed. As you can see, these are natural foods. These aren't supplements. This isn't something that you need to, search high and low for. These are just normal everyday foods that you're probably going to find in your grocery store. Then there's probiotics like yogurt and yogurt with live cultures. Be careful of that because there's a lot of yogurts, especially when you go to the grocery store. There's all these flavors, there's all these mix-ins that yogurts come with now, but you want to make sure if it can be just a plain yogurt with live cultures in it. If you want to put a little bit of honey for flavor, that's totally fine. But be careful of the ones that already come flavored because those have a lot of refined sugars in them usually. And remember, you want to avoid the refined sugars. Kefir is also good. Sauerkraut, I am guilty of that. I absolutely love sauerkraut. So I will often just open the jar and maybe take a little spoonful of it. I enjoy it. Kimchi is also a really good one, as is miso. And then you also want to eat foods that are rich in polyphenols like berries, green tea, olive oil, dark chocolate. I know I just said chocolate and you probably think, well, didn't you just say to avoid sugars? I did. Refined sugars. So a lot of chocolate, especially, the ones that you get in the grocery store, if you're sitting at that checkout line and you look down and see all those yummy candy bars, those are the refined chocolates that you want to avoid. But dark chocolate in moderation, don't be eating too much, please. In moderation, dark chocolate actually does have some good benefits to it. So you want to be mindful of what type of sweets that you're eating. You also want to limit those ultra processed foods that I talked about. Now, when we talk about processed foods, I should say that processed foods come in a spectrum. You can have processed foods like canned corn or frozen vegetables. Those processed because something is done to them in a factory. They're not just picked out and put on your table from the farm. So they're processed, but they're minimally processed. So it is okay to do frozen vegetables and canned vegetables when you need to. But ultra processed foods are the problem. And ultra processed foods are like potato chips, candies, cookies, cakes. Yes, all the good stuff. I'm so sorry. But these can actually feed those harmful bacteria and promote the growth of harmful microorganisms and induce inflammation in your gut. And that's the last thing that we want, right? And then getting back to the managing stress and getting enough sleep. This really, really influences your immune system. So you want to make sure that you're managing your stress and getting enough sleep. And when it comes to stress, there's a lot of different ways that you can manage it. And majority of the time, people think that it's hard to do. But even if you give yourself just 10 minutes a day of just Zen relaxation, maybe a little bit of meditation, or just listening to music that you like, or maybe one of those adult coloring books. Those actually seem to help a lot too. Whatever it is, just 5 to 10 minutes a day of winding down is helpful for your brain and for reducing stress. And then sleep. Absolutely, sleep is important too. And I know I've said all these things a lot, but it's so important that it really warrants repeating. I hope this helps. All right, let's get to our next question. And this one comes to us from Maddie. And Maddie asks, I've had severe cramps and have an appointment with a gastroenterologist. My husband suffers from irritable bowel syndrome, and he says my symptoms match what he has. Now I'm concerned. Can you tell me a little bit about IBS and what I need to know and do to manage it? Thank you for your question, Maddie. IBS can be a complicated diagnosis. Usually it's a diagnosis of exclusion, which means that we need to make sure that your symptoms aren't due to another more sinister disease before we say that they're irritable bowel syndrome. Irritable bowel syndrome usually has a collection of particular symptoms that raise our suspicion to it. You could have diarrhea predominant, or you can have constipation predominant. And a lot of times you'll notice that your mood is heavily affected by the symptoms of your IBS, or even vice versa. But as I mentioned, the symptoms of irritable bowel syndrome do come in a pattern that alert us to this particular diagnosis, but they can also be symptoms of a variety of other GI diagnoses. So I really do encourage you. It's great that you have that upcoming appointment with the gastroenterologist. I hope you're going to sit down, go through everything thoroughly, and get the answers that you need. Well, folks, that's all the time that we have for today. These were some wonderful questions, and I really, really thank you for sending them in. I'm very happy to help you, and I hope that these questions have helped all of you and learn a little bit about the gut and why it's so important. And it's so important to keep it healthy. It keeps your immune system going, your nervous system going, and it also keeps your mood healthy. So that's always a good thing, right? So eat healthy, reduce your stress, get enough sleep, get those good bacteria into your body, and do things that you can to reduce the bad bacteria from coming in. And as always, if you have any issues, discuss them with your physician. My name is Dr. Kamaljit Kaur, and it's been a pleasure. I wish you well. Have a great day.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.